I wanted to offer a couple of guides just on this material. I do realize that all of you have taken a pharmacology course either at Blaine or at another academic institution and have transferred credits in, so I want to honor that and not assume you don't know this information. I'm assuming you do know the information, especially knowing at least the curriculum of pharmacology that's offered at Blaine and having some conversations with instructors as well as students. So I think it's really important to at least understand some of these terms, and I'm going to highlight some of them that I really want you to know. I think some of these with medical terminology you can figure out yourself, but I think it's important to know that there are certain really good to know that some of these medications are not are good to take. When I say medications, I'm referring to over-the-counter drugs as well, regarding to end stage, and that some of these can actually accelerate organ failure. So particularly just looking at the information about nephrotoxicity and some of the over-the-counter drugs that can actually make the patient's health condition worse and accelerate organ failure. These definitions are really important to know. They are terms that you'll hear in continued education classes and likely to see on the licensure exam. So I've really spent some time on these terms. You've all had some pharmacology already, so as far as adverse drug reactions, I think you're probably pretty up to speed on that. The term polypharmacy is an important one to know, that it still holds of a use of 5 or more drugs a day is considered polypharmacy, and that includes supplements. So that's important to know. It's not simply prescription drugs, it's supplements as well as over-the-counter. And that doesn't mean that people that take multiple substances we change the verbiage there, that take multiple over-the-counter herbal supplements are doing something wrong to their system. It's a term. Poly means multiple. So this is not about pathologizing taking more than 5 over-the-counter or supplements. There are some health conditions that require people to take sometimes 10 to 15 drugs just to sustain life itself. I think of people with some of the chronic autoimmune health conditions such as Parkinson's, or another one that you see polypharmacy is lupus, because of just keeping the kidneys going, the heart going, the lungs going, since lupus can over time deteriorate the quality of organs, the vital organs in particular. So I think this discussion on transdermal patches is really important. Perhaps they're not as becoming as abused as they were 5-10 years ago. 10 years ago they really were kind of taking the place of opioids as far as a prescription drug of choice. And I think people were intentionally trying not to cause harm, and we're seeing this as an alternative. But transdermal patches can be quite addictive as well, and I've seen that clinically. And then just kind of looking at the advantages of different types of oral medications, or intranasal medications, and just the importance of cleaning these, especially those of you that are going into home health care. When you see these really dirty type of equipment around that people are using, to remind people the importance of cleaning them. There are people with visual loss, and so they may not notice how filled with bacteria and dirty inhalers have become, or incentive spirometers. So this is your opportunity to educate when you're in the home, knowing that in many cases nursing will not be in the home, so you are the healthcare provider that the patient is seeing. I think it's really important. You may have got this in in your pharmacy class. I suspect you haven't, but I could be wrong. I want to be wrong, but important to know how exercise affects pharmacokinetics. You need to know this, and it's important to know. So if you have someone on a transdermal patch, for example, that drug may be absorbing more quickly, and so you maybe see some interesting side effects with the patches. If people are doing more higher impact or more higher RPE type activities, it doesn't just mean doing aerobics. We're talking about just doing a more sustained activity, which is causing a stress on the various body systems. Increasing RPE, for example, can increase that drug absorption rate. And then I really want to just know that this statistic, I doubt if this statistic has changed in the last few years. This is updated in 2017, but over half of all medications prescribed dispensed or sold inappropriately, and that 50% of all patients fail to take them correctly. And this is, people that are skipping days because they want to save drugs. And so as a result of skipping days of drugs, sometimes they're taking that drug effects and knocking it back a couple of weeks, because it can take sometimes drugs that long to really have their full impact. So you may see some patients that are skipping, for example, taking their antidepressant medications, then noticing dizziness, noticing just maybe some irritability because they've decided to take themselves off it without speaking to their healthcare provider who prescribed the drug. And there's also, I think, just the memory component that people just forgetting that to take their medications sometimes, or just feeling so sick they're not able to access their drugs. This is a real issue that you may see in the healthcare environments, particularly in the home health setting or outpatient. And then the information about how long it takes for a drug to recruit is probably something you already got in pharmacy or your pharmacology class. And then I think that'll be it for now, and I'll do a short guide with the material specifically addressing the relationship between the PTA and the important role the PTA plays in helping people that are taking multiple drugs, or even one or two drugs.